Hey everybody, welcome to Hypnosis Week, going to be one of my favorite weeks. I am here with my friend, Dr. Mike Dow. Welcome.
Thank you for having me.
Mike is a psychotherapist. He's a best-selling author of a number of books, including The Brain Fog Fix, The Drained Brain.
Heal Your Drained Brain.
Heal Your Drained Brain. Heal Your Broken Brain, about his brother who had a stroke. And there's so much you can do. People don't understand that. There's so much. If your brain has gone to the dark place, there's so much you can do to heal it. But you have a new book coming out.
I do. Your subconscious brain can change your life.
Your subconscious brain can change your life. So how did you get interested in hypnosis?
So, Daniel, I obviously am a huge fan of the brain. I'm a huge believer that we all have this inner ability to heal ourselves, to motivate ourselves, to make those everyday changes. And, that's why I do what I do. And then I discovered clinical hypnosis. And to be quite frank with you, I went to this training partly because I needed some continuing education for my license.
Of course.
And I was fascinated and I was intrigued, and like many people, maybe somebody watching here today, I had some of those misconceptions, is this Vegas? Is this going to make me bark like a dog? Or can this really do what they say it can do? Because I'd read some of the literature and I thought, it sounds too good to be true. How does this really work? And then I went into my first practicum, and I remember one of my professors was a dentist, and she had this incredible voice, and it was about 30 seconds in, and I just remember feeling, and I'd done all of these mindfulness meditation workshops with some great MDs and PhDs, and I remember in about 30 seconds of 60 seconds going way deeper than I had ever achieved through hundreds of hours of meditation, just like that, in an effortless way. And and meditation is fantastic, and it just felt really different. And all of a sudden, in that moment, in that experience, I got it. And I became a little obsessed.
So hypnosis is it's a natural state.
Yeah,
it's a state people go in and out of all the time.
Yeah.
I think yesterday I saw Mamma Mia 2.
So did I.
I
saw it yesterday.
Great. I
well.
loved it. And that 2-hour movie seemed like it went by in a half an hour.
Yeah.
That's a hypnotic state.
Yes, it is.
Or if you drive, I went to medical school in Oklahoma, so I would go from Southern California to Oklahoma a lot, and there would be whole cities that I don't actually remember driving through. It's like all of a sudden it's 4 hours later, and that's called highway hypnosis. So they're natural states that we go in and out of a lot, and it's when time slows down or time speeds up.
Yes.
And hypnosis is just having a guide to go through those states, or to be able to use that state in a therapeutic way.
Yeah, and I think when people realize it, that they actually already do that, when they get engrossed in a great book or a movie, or realize, wow, I just drove home. I don't remember driving home, but sure enough, I pulled into my own driveway. That somehow there are all of these things going on in our brains all the time, but we could use them for our own good, whether it's something that's a little bit more medical, something a little bit more psychological, something in your business, all of these goals. And instead of it being something scary or mysterious, to be honest, it is a little mysterious sometimes to me, which I like.
Well, one of the reasons you're in the clinic is we did a scan on you today, a baseline scan, and tomorrow we're going to do one while you're in a hypnotic state. So how cool is that? And we're going to see, there have been a couple of imaging studies showing it's not what you would expect. So what you would expect when you put someone in a trance, obviously they're very relaxed, you would think their brains settle down, but that's actually not what happens. I mean, we'll see with you, but it actually, the frontal lobes, the most human, thoughtful part of the brain, fires up.
Yeah.
Meditation does the same thing.
Yeah.
We just did a prayer study a couple of months ago.
Oh,
it was
cool.
Fascinating.
Yeah.
So we will see. I got interested when I was a second-year medical student, which was 40 years ago.
Yeah.
It's disturbing. But I went, oh, well, how cool is this? And I watched our professor hypnotize a couple of the other students. And then when he did me, I never felt more peaceful. I loved, you don't tune out, you actually tune in.
Yeah.
But you do it in a very sort of calming, relaxing, wonderful way. And then I took a month elective. And when I was an intern at the Walter Reed Army Medical Center, I virtually hypnotized half of my patients.
That's incredible.
Everybody wanted a sleeping pill.
Yeah.
And I'm like, well, yes, I'll give you a sleeping pill, but can I hypnotize you first?
Yeah.
And see if you really need it. And everybody, they want more time with their doctor. And so everybody said yes, and I prescribed half the sleeping pills that my fellow interns prescribed. Because what did they teach us in medical school? First, do no harm. Use the least toxic. And so if you can heal with words and what is really directed attention.
Yes.
How cool is that?
I recently was diving into the literature and research, and I came across this story of yours that you saw people changing really the body, really, and blood flow, which other studies have really shown that people can do this.
Well, when I was a medical student and I was taking my elective at UC Irvine, Don Schaefer was my teacher. He was awesome. He showed us a video of an Indian psychiatrist who put a patient in a trance, had them pop up the blood vessels in their hands. So purposefully directed attention to their hand, pop up the blood vessels, and then he put a needle through the blood vessel and he pulled the needle out. And so it's bleeding on both sides of the blood vessel. And in a trance, he had the woman stop the bleeding on one side while it's going on the other side, then stop it on that side and get it to bleed on the other side.
Isn't that incredible?
It's wild.
That
you would
boggles my
think you
mind.
had to set up some illusion in Hollywood to do this. So when I was an intern, my first rotation was in the emergency room. And at Walter Reed in Washington, D.C., it's a busy emergency room. There's a lot of noise going on. But I walk on the ward. It's like 6:30 in the morning, and there's a woman screaming. And I'm super curious, which is not always a good thing. And so I popped my head in, and I saw this woman whose leg was swollen. She had something called a DVT, or a deep venous thrombosis. She had a blood clot in her calf that was preventing blood getting out of her leg. And so she has this big swollen leg. And the chief resident, her name was Wendy. She was not nice. And she's not nice. She was screaming at the patient because every time she stuck the patient screamed louder. And Wendy was getting frustrated. And what happens to blood vessels when you're upset is they clamp down. They're not helping you when the patient's upset. And so I felt so bad for Wendy and for the patient. And I said, do you mind if I try? And she said, I've been starting IVs for years. What makes you think you are so special? But if you want to try hotshot, go ahead and look stupid. And she threw the IV set at me. The first thing I did was not poke this woman. The first thing I did was go around to her head. She was just screaming at her from her feet. And I said, hi, I'm Dr. Amen. I need you to slow your breathing. And I said, when you breathe too fast, all your blood vessels constrict and there's no way we're going to start an IV on your foot. Breathe with me. And so I slowed my own breathing, thinking Wendy was going to kill me when I failed, right? Because I had no expectation this was actually going to work. I just seen the video. And then and then I had her focus on a spot on the wall,
Yep.
right? It's the first step.
Yep.
You know, you take outside focus and all the distractions, you bring it to a point. So, and then you get the focus internally. So I had her count to 10, had her close her eyes, and then had her breathe, and then imagine relaxation. And then while I'm doing the whole induction thing, I'm going, I bet you didn't know that if you focused on your feet, you could actually make a blood vessel appear and really help me in this situation. And a blood vessel just popped up.
I love
as
it.
soon as I made this suggestion, and I put the needle in.
Isn't that incredible?
And then I kept her in the trance just to relax her, and I wheeled her to X-ray.
Yeah.
But the one mistake I made is when Wendy saw this and her mouth was like wide open, and I just winked at her, and she never looked at me the same way, and I don't mean that in a good way, but it's so powerful.
It's powerful. And you know, this story, you know, what I love about that story, Daniel, is it's this integration. Not only is it powerful, it reminds me that our bodies have this ability that our brains can help tap into, but it's also the integration between, you know, it's not saying, you know, yes, hypnosis by itself was used as anesthesia before modern anesthesia. We're not.
And during the Civil War.
Yeah.
Right? It was used in World War I when they actually ran out of anesthesia, that it was actually brought to the U.S., if I remember right, by an OBGYN who helped deliver babies. I actually have a friend who delivered all 3 of her babies using hypnosis without any epidurals.
It was the anesthesia. It was the go-to before, you know, and I think today people are just, maybe they're listening saying, well, I don't need it. It's out of date. But, you know, today they're publishing these trials, and, you know, this one boggled my mind. Of course, you know, Europe, because I think we have Vegas, I think Americans are a little bit less likely to accept hypnosis. We have to backpedal. We have to sort of prove it first, which is why I'm so glad. Thank you for doing this brain scan. We're going to scientifically prove it to, you know, I think especially Americans who are a little bit apprehensive. But, you know, they did this hypnosedation study first in Europe, and now they're using it in the US. And they had there were these subjects in this trial, and it was women with breast cancer, and they gave them hypnosis first, or the same amount of time just relaxing. And I believe in the trial they gave them as much pain medication and sedation, local sedating medication as they wanted, as they needed. And then they measured pain, and then they also measured inflammation. They found that the hypnosis actually, number one, saved the hospital money. It decreased the surgery time. It really increased the pain scores, not only in the short term, but also the long-term pain, and it decreased inflammation. So it's sort of this, oh, maybe this isn't something that we should just throw out as this outdated model, and maybe there are all these fantastic ways to integrate it with these modern practices, which I think is just really exciting.
Well, stay with us. When we come back, we're going to talk about the different uses of hypnosis, and I'm going to tell you a fun story that got me into all sorts of trouble. Stay with us.
I will embrace my many strengths.
I will not be tormented by my past.
I will find the right balance.
I will be calm and courageous.
I will be free. I am not just bipolar.
I am not just autism.
I'm not just depression.
I'm not just ADD.
I am not just anxiety.
I am not just OCD.
I am not just PTSD.
Welcome back. We're in Hypnosis Week, and I'm here with Dr. Mike Dow, and let's talk about some of the uses. Some of the appropriate uses and maybe some of the inappropriate uses. You know, there are many myths about it, like you'll lose control. I mean, I've been doing it for 40 years, over 1,000 patients, nobody loses control. You'll do something against your will. I've never had that happen, although I'm not giving people, and you probably aren't giving people the suggestions to do bad things.
That's right.
Right? Never heard of that.
False memories, that it's going to create false memories. Absolutely not. Unless I would lead you into something, and you and I are never going to want somebody to believe something that's not there, of course.
Well, and memory's tricky because you can make up memories.
Of course.
And that's one of the reasons they actually took hypnosis out of courtrooms.
Yes, that's right.
Because they found the memories were not always accurate.
That's right.
And I think that's fair to say.
But it's also
the mind is a meaning machine, and it creates things all the time.
Which is also why, in police lineups, it's double blind. So the policeman who's there with you doesn't know who their number one suspect is, because he's going to look at you and say, so do you think it's witness number 2? And, that policeman's, even the tone of his or that policeman or policewoman's voice is going to lead you into saying, maybe it is suspect number 2. So yes, there's a reason why that suggestibility is something to notice, but, the brain isn't going to just... I think people are a little bit afraid of that it's going to, I'm going to plant some memory of Santa Claus, breaking into my home and, robbing us when we were 7. Well, that's not going to happen, right? It's
Let's hope not. So where is it helpful? It can help people stop smoking.
Absolutely.
It can help them with weight, as long as it's part of a rational weight program, right? You're not going to be able to eat everything you desire, and just because you've been under a trance, that will magically make it happen. But it certainly can support it.
Absolutely.
I've seen it really be helpful for pain syndromes.
Oh, yeah.
And
huge.
I also think it's incredibly helpful for sleep.
Yep. All of these things, and I think on a really basic level, when you look at and another thing you're going to be doing for me here at Amen Clinics is looking at a QEEG and looking at my brain waves. And at a very basic level, hypnosis is simply slowing the brain waves down from, those...
Well, we don't know. We're going to find that out.
Hopefully.
Right?
We'll find that out.
Meditation fooled us. Meditation actually sped them up.
Yeah.
That there's this, so we think of delta, sleepy waves, theta, daydreaming waves, alpha, relaxed but focused, beta, focused, high beta, anxious.
Yep.
Well, I hadn't even heard of gamma waves, which are super fast.
Right.
But when people go in meditative states, their gamma waves elevate. And I'm like, wow, that's so interesting. That meditation doesn't tune you out, it tunes you in. And so our hypothesis, we'll see, with your brain, is will slow waves surge? Would make sense, or is it really fast waves? And we published a study on a Kundalini yoga form of meditation. It's called Kirtan Kriya.
I love that.
It's a chanting, Sata Nama. And after 8 weeks of doing this simple 12-minute meditation, they had stronger resting frontal lobe function, stronger resting executive function, focus, forethought, judgment, impulse control.
Isn't that incredible?
Isn't that crazy? So when I was an intern, my year of hypnosis, I decided I would do groups on the units I was on for the nurses, because I realized if the nurses loved me, my internship year would be awesome. But if the nurses hated me, then my internship year would be hell.
You're very smart.
And being married to a nurse, I know that is absolutely true. And so I used to run a group for them where we do weight loss and smoking and pain reduction, anxiety reduction, and it was so effective.
Yeah.
But at the end of one group, this really pretty nurse came up to me and said, I'm having problems getting pregnant. Do you think you could help me? And I'm like, I don't know. That sounds interesting to me.
I'll take this on. Let's find out.
And what happened is because she was having trouble getting pregnant, every time she had sex with her husband, she would start crying, right? So she's traumatized by her infertility.
Right.
And so I put her in a trance and I made her a tape and I had her imagine her uterus and her fallopian tubes, which most people don't know, but they're all muscle. They're all smooth muscle. And what happens to muscle when you become unhappy, when you become anxious or you become stressed, is they clamp down, just like the smooth muscle on the blood vessels on the other patient that we talked about.
Yeah.
And so I made her a tape so that after every time she had sex, she'd listen to the tape and it would put her in a relaxed, hypnotic state.
And that's what you want.
And 2 months later, she's pregnant.
Makes sense.
But the mistake I made was I went home and told my wife, I said, hey, I helped a really pretty nurse at work get pregnant. That didn't go over very well.
Well, I think it makes a lot of sense. And, there was an Ohio State University Department of Psychiatry study that actually measured immune response. And they actually used really stressed out medical students as they were facing their exams. And the control group didn't practice self-hypnosis, so they were taught hypnosis and then they used it at home. And then they measured their immune system response via blood, and the control group didn't practice self-hypnosis. And they found that, and of course, in medical school, these exams are very, very stressful. So it may mimic something that you're facing at home, a stressful life event, going through a divorce or losing a job or something. And they found that the people who practice self-hypnosis, those medical students, the markers of their immune response went up, and the people who did not practice self-hypnosis, they went down significantly. So, I think that there's hard, solid evidence that this integration of mind and body is there. And it's not this airy-fairy, Berkeley granola crunchy thing that we're just going to visualize things and they're going to happen. It actually works, in study after study, in bedwetting children, they put it up against, a prescription antidepressant or hypnosis. They were both equally effective. It's yes. And I think the other thing, a VA study looking at smoking, I think the one mistake people make, there's all these hypnosis clinics and, strip malls and, and they think, oh, I'm just going to go to one hypnosis session and then I'll be done and I'm going to lose weight or quit smoking. And I think those are the two people think of it I think those are probably the two, right? Smoking and weight loss. And they think, I'm just going to get hypnotized once and then I'll be cured. Well, it doesn't really work quite like that. And you still have to make other changes, and it works in an integrative way. So I like this VA study because they were still using other strategies. So they were using replacement therapy. These veterans who were trying to quit smoking were still given the patch. So it wasn't, oh, let's just go to that mini mall and get one session of hypnosis and then you're cured. It wasn't like that at all. It was several sessions. It was using other strategies with hypnosis as a sort of 360 whole person centered treatment. And they were, of course, the veterans who got hypnosis were much more likely to quit smoking.
So the other group got the traditional things, and the hypnosis group got the traditional things plus hypnosis, and they had a significant increase.
That's right.
And that's my experience.
That's right.
So another one of my favorite stories. Still when I was an intern, now I'm on neurology. And neurologists don't like psychiatrists. Isn't that interesting? Neurologists and psychiatrists got divorced 100 years ago.
Yeah.
And it's funny, the founder of psychiatry really is Sigmund Freud, who was a neurologist. Mm-hmm. But I had a very famous patient, because Walter Reed's this really well-known place, and he was a World War II hero who'd written a best-selling book. He was able to rescue many Jews out of Germany during the Nazi era. And he now had Parkinson's. And he's as sweet as can be. And what was different about me when I was an intern is I like to sit and talk to my patients. Because, you know, I mean, I'm a psychiatrist by nature. I like the relationship. And so he and I had this very good relationship. And I'm on call one night, and he's like, will you give me a sleeping pill? And I'm like, well, of course. But can I hypnotize you instead? Now, he has Parkinson's. And he had bad Parkinson's. And his tremor was really terrible. And that can really interfere with sleep.
Oh, yeah.
And I remember putting him in a trance, and before I put him to sleep, his tremor went away. And in my mind, I went, oh my God, that's so cool. Oh my God, that's so cool. And then, but you know, I mean, I was cool. And my daughter, who's 15, says I don't have game. Which is funny because I got her mother, so I totally have game.
Who's smart and beautiful, so clearly you have game.
I have game. But anyways, I was really cool in that situation, but internally, the little 4-year-old in me is jumping up and down. This is so cool. This is so cool. So in the morning when we were on rounds, I told my attending, his name was Dr. Jabari, about the hypnosis session the night before and how his tremor went away in a trance. Now, Parkinsonian tremors go away when they sleep. So there's some connection between hypnosis and sleep, but he clearly wasn't sleeping. And I remember when I told my attending, he rolled his eyes at me. And I looked at him, I went, no, watch. And in front of 8 of my fellow interns and the attending, I put him in a trance, and now he's fully awake and he has no tremor.
Isn't that incredible?
And Dr. Jabari went, whoa.
Yeah.
And that afternoon, we filmed it. And he did an EEG.
Oh,
cool. You're going to have an EEG. And it became my first professional paper.
That's incredible.
All right. And so it's this mind, brain, body connection. Most people don't know your body responds to every single thought you have. If you have negative thoughts, your hands get colder, they get wetter, your muscles get tense, your heart rate variability goes down, and your brain starts to not behave right. Right? Your body responds to every thought you have.
Well, what condition isn't exacerbated by stress? So if you know, hypnosis on a very basic level, you know, the father-son psychiatrists who, you know, Spiegel and Spiegel, who were, I think they were Stanford and was he somewhere in New York? Stanford, and the other one was at one of the institutions in New York. You know, they said that, you know, hypnosis at a very basic level is just the changing of the guard from the, you know, this fight or flight response to this rest and digest response. So on a very basic level, it makes sense for almost any condition. But, you know, and a lot of the you know, I have so many of these stories too, where I'll treat somebody. And I love, you know, as somebody who treats PTSD, and you know, that's one of my passions, is helping people, you know, especially in this day and age with so much trauma, you know, the history of sexual abuse, physical abuse, and people haunted by this, and realizing that, yes, we can actually help you with that, you know. So I use a lot of different modalities. I use bilateral stimulation to help them, and I love using hypnosis, you know, because hypnosis really allows us to get in there, and it allows us to use the, you know, it's like we're opening up this editing suite on our Mac, you know, and it's like the delete button is working, and you know, we have, you know, here we are in this great studio, and we have this TV, and it's like we're opening up this studio, and it's like the delete button now works, the fast forward button works, the rewind button works. And I was treating this man with a history of sexual abuse, and after our session, he looked at me and he said, "That's the weirdest thing." And he had this, he's like, wait a minute, what? And we sort of implanted images that he chose, sort of over the traumatic memories. And he said, "That's the weirdest thing." And he had this, he's like, I still, wait a minute, what? And we sort of implanted images that he chose, sort of over the traumatic memories. And he said, I still know that I was abused, but now when I'm thinking about it, it's like all I'm seeing are those positive images. That's like a miracle. Like, and it was just wow. That was one of the first maybe 10 cases I used hypnosis with to treat PTSD, and after that session I was sold.
You were hooked.
I was hooked.
Yeah, because that's how we get hooked when we help people.
Yeah.
I mean, we love that, and it can help you. So if you stay with us, what we're going to do is actually go through the steps of how you can benefit from hypnosis at home. Stay with us. Welcome back to Hypnosis Week. Well, today we're going to teach you how you can use some of the principles that Dr. Dow and I have learned at home. It's amazing. I was on cardiology. So I had another one of those great story moments of a chaplain who had a arrhythmia. So he had an abnormal heart rhythm, and the medications weren't working, and he couldn't sleep. And I'm like, well, I'll give you a sleeping pill, but can I hypnotize you? And when I put him in a trance, his heart rhythm normalized. Like, whoa.
Yeah.
And the cardiologist, this was nicer to me than the neurologist. He's like, oh, can you do that for me? And the same thing happened, and that became my second professional
I love it.
paper. But on my cardiac rotation as an intern, I couldn't sleep because people were dying.
Yeah.
Right? I mean, they were seriously sick, and I couldn't sleep. And then I had this little epiphany. It's like, you're helping everybody else sleep. Why don't you do the same thing for yourself?
Yeah.
And I got so good at it, I could put myself to sleep in like 2 minutes.
I picture myself when I'm lying in bed, that the bed is in an elevator and it's going down, and I actually use movement, and I close my eyes, and I can feel the bed as if the bed is like on like a pulley, and it's going down 100 floors very slowly, not in a scary way. But it's the coolest feeling when your mind can actually help you to sort of drift down, and using these self-hypnosis skills, which is a lot of the research. That's what they do. Instead of having to go every time, you can use these at home, and I know that your online community, you teach them, and then you can use an audio track at home for whatever concern. And a lot of the recent research is so exciting because all of these, quote, we have nothing for you, modern medicine, fibromyalgia, chronic pain. Well, guess what? All of the recent research, hypnosis says otherwise. Hypnosis says we have something for you. We can improve the quality of your life.
So some simple steps. So for me, when I put someone in a trance, I have them focus on a spot on the wall a little bit above their eye level. And what that's doing is decreasing the distractions from the world. And then close your eyes, because you can take the outside focus to a spot on the wall inside.
Yeah, and really, the conscious brain can really, I think it tends to think about, what you need to get at the grocery store, the organic eggs or the berries. Hopefully you're buying those organic berries, and all the things you need to do tomorrow. So isn't it so nice that just by closing your eyes and by finding that spot, that hopefully you're going to be transitioning to this other part and using these other brain structures, the subconscious.
The next thing I do is I have them purposefully take 3 deep breaths and simple suggestions. Breathe in relaxation, blow out the tension.
Yeah, I like that one.
It's something that's purposeful that everybody can do.
Yeah.
And then I'll do progressive muscle relaxation. And some people will have them actually tighten,
squeeze, and then release.
And release. What I do is I have them just roll their eyeballs up. So the little tiniest muscles in your body, or some of them, roll your eyeballs up as far as they'll go with your eyes closed. Hold them up, and then let them come back down to a normal position and just notice how relaxed they are.
Yeah.
And then I have them visualize that relaxation spreading like a warm penetrating oil from the top of their head all the way down to the bottom of their feet.
Yeah.
And I do it slowly. And progressive muscle relaxation is another technique that has been found.
It works in and of itself, and I love that you build it in. You know, other researchers have really integrated it into hypnosis as well. So it's sort of a 2-for-1, which is great.
It's a 2-for-1. And then, just like you had the bed go down, I'll do something called a deepening technique. And it may be at the top of a long staircase.
Yeah.
And I'll have them see the flowers they like and colors they love. And as they walk down the staircase, I'll count backwards from 10. And it's just the idea of going down.
That's my favorite. And when somebody the first time somebody counted for me, there's something about that. And for anyone I've ever treated, I watch their body, I watch their eyes, the way they start to flutter, sort of those little jerks when somebody's falling asleep. I watch those, as the body just starts to release. That's when personally, when I'm using hypnosis, that's my favorite part of it, are the steps.
My favorite part, though, is when you get to the bottom. It's like, what do you do when you get to the bottom? And that's the guided imagery. And so it's often different.
Yeah,
but usually I'll have them imagine the most beautiful part with all of their senses. See what's there, hear what's there, smell and taste the freshness in the air, and feel what's there. So you begin to activate many different areas of their brain.
And what's so incredible is that the subconscious brain is it can almost feel, I describe it as virtual reality using just the mind. So, by using those words, you can actually do almost anything, and that's what's so cool about it. It's so exciting because you can transport yourself to any world you want to go. That's why when we were talking about PTSD and just a moment ago, that's why that screen just sort of pops up. So if you want to go to a screen and you want to image a new screen and write a new story and then project that story because you're now the director of this new story that you're writing for yourself, you can do that. And of course, if you want to relax, then just, of course, the most beautiful field you've ever seen, which is incredible.
And I love what you said about creating a new story, because ultimately in psychotherapy, the most important thing you can do for yourself is rewrite your story, right? Rather than you're a victim of this and that you're a superhero, that you're powerful, that you can be in control of your thoughts and of your behaviors, that the addictions don't have to run your life anymore.
That's right.
I often have people find a pool, a warm pool with healing waters, and the water helps to not only soothe their emotional pain or their physical pain, but it also helps to reset their mind.
I love water. I also love clouds. I love floating. Imagining yourself falling into a warm cloud that's sort of enveloping your entire body, or anything that's sort of soft, that's sort of wrapping you up. And what's also just so wonderful is that in this stage, now you have the ability, because you've used that imagery and those 5 senses. If you're somebody, let's say there's something that's warm and burning, so somebody who's survived a burn, or maybe there's something that's aching, and maybe there's a pain in your shoulder that feels sort of hot. Well, of course, if something's hot, maybe you want that water to feel cool, or maybe you want that cloud to feel light. If there's something that's tight, maybe the cloud is going to feel loose. So then you can kind of see how at this stage you can sort of use whatever imagery you want. And what's so fascinating, you know, Daniel, I was studying, I took a deep dive into every study, and I looked at, you know, the IBS script, the fibromyalgia script, and they all had a lot of things that were similar, but then they all had different things that were, some things that were different, you know. So for the IBS script, if it was IBS for constipation, it was imagine that inside it's sort of an amusement park slide. And that slide inside of you can just travel freely. And you can kind of see how if the mind is picturing an amusement park slide, how that imagery would work, right? And so every script is sort of targeted to whatever you want. And it's sort of, well, you can use these scripts, or you can also tweak it in your own mind. So even if they're using your online community, you can kind of say, oh, well, I want my water to be warm. Or no, but I have like a ice pick headache. Well, then make your water warm inside your own mind. So you can kind of almost do whatever you want to do in those moments too, which is kind of fun.
And that's ultimately the goal, to get you to be in charge of your own brain. How your subconscious brain can change your life. That's the title of your new book.
Yep.
How can people learn about you and your work?
My website is drmikedow.com, drmikedow.com. And I'm just so passionate about this work. I know you and I are like-minded people, because first and foremost, we want to help people. I wrote this book because I knew that there are elusive conditions. There are people struggling with trauma, abuse, and they're looking for other integrative answers, which is what I know you do here at Amen Clinics. I was just in the waiting room and I saw people who were just happy to be here because they knew they were finding solutions. And I think they're going to find those in this book as well as yet another tool in the tool belt for people. So obviously, they can find the book on Amazon, or they can go to my website or wherever they want to go to find out more.
And it's coming out March 12th, 2019.
That's
and you're going to have a public television special.
I may have a public television special, and we'll see. Yeah.
So exciting.
Yeah.
Hypnosis Week. Thanks for being with us.
Thank you.
Use the code podcast10 to get a 10% discount on a full evaluation at amenclinics.com or on our supplements at brainmdhealth.com. Thank you for listening to the Brain Warriors Way podcast. Go to iTunes and leave a review, and you'll automatically be entered into a drawing to get a free signed copy of the Brain Warriors Way and the Brain Warriors Way cookbook we give away every month.